are your shoulder chronic phase open chain exercises. First exercise is gonna be a bent over row using a dumbbell. I'm gonna show you on this side of the table. Typically we do this exercise this way. I'm showing you here just so you're able to see better. You have one leg down. Mistake patients make is they let their posture collapse. All these exercises for the shoulder, we want to do in proper posture, low back, thoracic spine, flat, head in neutral, not overextended or overly flexed. And then you're going to do your row with your 50-pound dumbbell from here. Okay, that's a single arm bent over row. A double arm bent over row. I'll show you from the side again. Here with my 100-pound barbell. You're gonna go into your hip hinge, spine flat, shoulders retracted and depressed, head in neutral, and you're gonna pull the bar in towards your chest with a shoulder retraction. So you're bent over row. Double arm, single arm, then double arm. Next we have angel wings. So with this exercise, you're gonna have the band here. It's kind of like your Brugger exercise, palms up, and you're gonna go out and squeeze those shoulder blades together. You can do this at 0, do it at 90 degrees here. Where again, you're trying to squeeze those shoulder blades, coming out, retracting as you go back. We're doing it here where it's more like a Brugger, where you keep doing a little more external rotation at 0 degrees. Next exercise is a floor press. So this one we can use the bar if you have someone to hand it to you, or you can use dumbbells. So we like doing the floor press exercise here so you don't get too much shoulder extension on the way down. Or you would do the same here with the dumbbell, and you can change the angle of the dumbbell, of your forearm and of your shoulder. Integrate one muscle more than the other. With the dumbbell you can do a little more in and out motion to go a little more chest, or keep them nice and tight and get a little more tricep. The further in you go, the more tricep you're gonna get. The further out, the more pec you're gonna get. The next one we have is long curl press. Long head curls. So this one, the long head curl looks like this. You're in shoulder flexion and elbow flexion. This is one they say the beaches dot way to get your bicep. You can also do this exercise with a band. You would just have the band at same thing about shoulder height. And let's see, going like this. Same idea, but using the band. There we go, now you're able to see a little better. So those will be your long head curls. Go up and out and up. Bring this back just a little bit so you can see it a little better. So out, up, out, up. Gonna be your exercise with a barbell. Then you have curl the press. So you can do curl the press this way with the bicep, a little more bicep bias. Or you can go this way with a brachialis curl, reverse curl into a shoulder press that's gonna get, again, more delt. It's gonna incorporate mostly just deltoid there since your bicep is a little bit turned off in that pronated arm position. And then clean the press, you start in the pronated position. You fling the bar up here from here, you bring it up, and then you press. And then you bring it down. You can swing your hips and bring the bar up, press, back down is your clean and press. Then we have military press, which is gonna be out in that kind of 45-degree angle compared to a straight up shoulder press, military press, shoulder press, military press. And the last couple are extra rotation with supination. So with this one, you want to start with the band in a pronated position, your hand in a pronated position. You're gonna go into that supination as you externally rotate and come back in. Again, this is gonna get a rotator cuff because you're doing external rotation, and you're gonna hit your bicep at the same time doing that supination at the same time. For the uppercut exercise, you want the weight down here, and you're gonna pull the band across your body into an uppercut position. Change your angle of your body on the band and come up, and we're gonna hit a lot of pec and isometric of your subscap, or you can do the same uppercut exercise standing on the band. It's a good way, though, if you have a patient or in an area where you don't have, you go here and you're gonna go up through the band here. And again, you can see we're getting a nice isometric of the subscap and a concentric pec.